It is 2:47 in the morning and you are walking to the bathroom for the third time tonight. Most people blame a weak bladder or simply getting older. But here is what may surprise you. If you are passing a large amount of urine each time, your bladder may be working normally. The real trigger could be fluid hiding in your swollen ankles, interrupted breathing while you sleep, rising blood sugar, or even the time you take one of your medications. In fact, what happens around your ankles at 6 in the evening may explain what happens in your bathroom at 2 in the morning. So before you stop drinking water, buy a bladder supplement, or skip a prescribed pill, listen carefully. In this video, I will show you one simple distinction that can immediately narrow down the possibilities. Are you waking because your bladder is full, or are you using the bathroom because something else woke you first? And near the end, I will give you a simple 3-night tracking method that can help your healthcare professional understand the pattern much faster. Remember this line, the bathroom trip is the alarm. It is not always the fire. This video provides general education and cannot diagnose your individual condition. Never stop or change a prescribed medication without consulting the qualified healthcare professional who manages it. Now think about your most recent nighttime bathroom trip. Was your bladder truly full? Did you pass a large amount of urine? Or did you feel a powerful urge only to pass a very small amount? That difference matters more than most people realize. Imagine 2 adults who both wake up 3 times every night. The first person passes a large amount each time. That suggests the kidneys may be producing more urine during the night. The second person feels a sudden, intense urge, but passes only a small amount. That could point toward bladder irritation, reduced bladder capacity, incomplete emptying, or an overactive bladder. Now imagine a third person. This person wakes because of back pain, loud snoring, or insomnia. Once awake, they notice a mild bladder sensation and decide to visit the bathroom. All 3 people report the same problem. I wake up 3 times to urinate, but they may need 3 completely different evaluations. That is why counting bathroom trips is only the beginning. Doctors call repeated nighttime urination nocturia. It becomes more common with age, but common does not mean meaningless. When it repeatedly interrupts sleep, drains your daytime energy, or forces you to rush through a dark house, it deserves attention. Poor sleep can affect concentration, mood, memory, balance, and energy. Nighttime urgency can also increase the risk of falling, particularly when someone stands too quickly or hurries to the bathroom while half asleep. This is not about frightening you, it is about helping you notice a pattern before exhaustion and bathroom trips become your accepted nightly routine. The first possible cause is the most obvious, but even here, many people make a critical mistake. They drink very little during the morning and afternoon. Then, after dinner, they try to catch up. They may have 2 large glasses of water, a cup of tea, and another drink while watching television. When those fluids produce several nighttime bathroom trips, they respond by cutting out water almost completely. Neither pattern is ideal. Your kidneys continue processing fluid after you fall asleep. A large amount consumed late in the evening does not disappear simply because you went to bed. Caffeine may add to the problem. Coffee is not the only source. Tea, cola, energy drinks, chocolate, and some over-the-counter products may also contain caffeine. For some people, caffeine increases urine production or makes the bladder feel more sensitive. Because its effects can last for hours, even an afternoon cup may affect the night. Alcohol can create 2 problems at once. It may increase urine production, and although it can initially make you feel sleepy, it may fragment your sleep later. You may therefore produce more urine and wake more easily. But do not try to solve this by intentionally dehydrating yourself. Severely restricting fluids can contribute to dizziness, constipation, low blood pressure, weakness, and concentrated urine that may irritate the bladder. A safer approach for many people is to drink their normal fluids more evenly during the day and avoid large drinks in the final few hours before bed. Your ideal fluid intake depends on your medical conditions, medications, activity, climate, and any instructions from your clinician. Someone with heart or kidney disease may have very different needs from someone without those conditions. The goal is better timing, not less water at any cost. But the next possible cause cannot be fixed by changing what is in your drinking glass. It may be sitting inside your medicine cabinet. Diuretics, often called water pills, help the body remove extra sodium and fluid. They may be prescribed for high blood pressure, swelling, or certain heart conditions. Frequent urination can be an expected effect. Some diabetes medications help the kidneys remove glucose through the urine and may also increase urination. Other medicines can affect nighttime bathroom trips indirectly. Some may contribute to ankle swelling, others may increase thirst, disturb sleep, cause constipation, or affect how completely the bladder empties. Even over-the-counter products can matter. Certain sleep aids, cold medicines, allergy pills, and supplements may affect alertness, balance, or urinary function. This does not mean your medication is harmful or unnecessary. It may be protecting your heart, kidneys, blood pressure, or blood sugar. The important question is not which medication should I stop. The better question is, could the dose or timing of any medication be affecting my night? Write down every product you take and the exact time you take it. Include prescriptions, pain relievers, sleep products, vitamins, and herbal supplements. Bring that list to the clinician who manages your medications. In some cases, a medication can safely be taken at a different time. In other cases, changing the timing could be ineffective or risky. Never skip, move, double, or stop a dose based only on a video. Now we come to the clue that many people never connect with their bladder. Look at your ankles in the evening. Do your socks leave deep marks? Do your shoes feel tighter at night? Do your feet or lower legs become puffy after sitting or standing for several hours? During the day, gravity can allow fluid to collect in the lower legs. This is sometimes called dependent edema. When you lie down at night, some of that fluid returns to your bloodstream. Your kidneys may then filter it and turn it into urine. The fluid that appeared to be resting in your ankles at dinner can become a bathroom trip several hours later. That is the ankle-to-bladder connection. Consider someone who sits in a chair for most of the afternoon. By evening, their socks have left clear rings around both ankles. They go to bed at 10. Once their legs are level with the rest of the body, some of that collected fluid moves back into circulation. At midnight, the bladder fills. At 2, it fills again. The person blames the bladder, even though part of the story began in the legs. Mild swelling can happen after prolonged sitting or standing, but persistent or worsening swelling should not be dismissed. It can also be associated with vein problems, medication effects, or conditions involving the heart, kidneys, or liver. Nighttime urination and swollen ankles cannot tell you which cause is present. They are clues that deserve proper evaluation. New swelling in one leg, especially with pain, redness, or warmth, needs prompt medical attention because a blood clot is one possible cause. Swelling combined with chest pain, fainting, or severe difficulty breathing requires emergency help. In the United States, call 911 for potentially life-threatening symptoms. For mild swelling that has already been evaluated, a healthcare professional may recommend movement during the day or elevating the legs earlier in the evening. Compression stockings help some people, but they are not appropriate for everyone, particularly people with certain circulation problems. Ask a professional before beginning to use them. Now ask yourself another question. What if your bladder is not waking you at all? What if your breathing is waking you? Obstructive sleep apnea causes the airway to repeatedly narrow or close during sleep. When breathing is interrupted, the brain briefly wakes the person so the airway can reopen. These awakenings may be so short that the person does not remember choking or gasping. They may remember only one thing: walking to the bathroom. Sleep apnea may also affect signals involved in fluid balance and urine production. This is one reason repeated nighttime urination can appear alongside sleep apnea symptoms. Pay attention to the complete pattern. Has anyone told you that you snore loudly? Has a partner noticed pauses in your breathing? Do you wake gasping with a dry mouth or with a morning headache? Do you feel exhausted despite spending 7 or 8 hours in bed? Do you struggle to stay awake while reading, watching television, or driving? Not everyone who snores has sleep apnea, and not everyone with sleep apnea has obvious snoring, but repeated nighttime urination combined with loud snoring, gasping, witnessed breathing pauses, morning headaches, or significant daytime sleepiness is worth discussing with a healthcare professional. And if you become dangerously sleepy while driving, do not try to push through it. Pull over safely and seek medical advice. Treating a sleep disorder may do more than reduce awakenings. It may improve the quality of the sleep you get between bathroom trips. This leads to another important distinction. Some people wake because their bladder is full. Other people visit the bathroom because they have already awakened. Back pain, arthritis, restless legs, anxiety, reflux, room temperature, noise, insomnia, and medication effects can all fragment sleep. Once you are awake, you may notice even a mild bladder sensation and think, "I should go now so I do not have to get up later." Over time, that can become a habit. Tonight, when you wake, pause for just a moment before standing. Do not ignore a strong urge, but ask yourself, did the urge wake me suddenly, or was I already awake before I noticed it? That single observation may help separate a bladder signal from a sleep interruption. But the next cause tends to create a different clue: larger amounts of urine combined with unusual thirst. When blood glucose becomes very high, the kidneys may try to remove excess glucose through the urine. Water follows that glucose, which can lead to more urine and greater thirst. Possible clues include frequent urination during both the day and night, unusual thirst, fatigue, blurred vision, unexplained weight loss, or recurrent infections. These symptoms do not prove that someone has diabetes. Many conditions can cause thirst, fatigue, and urinary changes, but a new or worsening pattern deserves a medical evaluation. A blood test can provide information that symptoms alone cannot. If you already have diabetes and your nighttime urination suddenly increases, review your glucose readings if you have been instructed to monitor them, and contact the professional managing your condition. Do not double a medication dose or make an extreme dietary change based on one symptom or one unusual reading. Now let us discuss an important cause for men. The prostate is located below the bladder and surrounds part of the tube through which urine leaves the body. As men age, the prostate often becomes larger. A non-cancerous enlargement is called benign prostatic hyperplasia, or BPH. As the prostate enlarges, it can interfere with urine flow. The bladder may need to work harder, and it may not empty completely. The clues can include difficulty starting, a weak or interrupted stream, dribbling, straining, frequent small trips, or the feeling that urine remains after you finish. Imagine filling a container before it has been completely emptied. It reaches its limits sooner. In a similar way, a bladder that retains urine may create more frequent urges, even if each trip produces only a small amount. An enlarged prostate does not automatically mean prostate cancer. However, similar symptoms can have different causes, so an examination matters. If you develop a strong need to urinate but cannot pass urine, particularly with pain or swelling in the lower abdomen, seek urgent care. Acute urinary retention can harm the bladder and kidneys. Women may experience a different set of changes. After menopause, changes in estrogen levels can affect tissues around the vagina, urethra, and bladder. Previous childbirth, pelvic floor weakness, or pelvic organ prolapse may contribute to urgency, leakage, or incomplete emptying. Overactive bladder can affect both women and men. It often causes a sudden urge that is difficult to control, frequent trips, and sometimes leakage before reaching the bathroom. Pelvic floor exercises can help certain bladder control problems, but more squeezing is not always better. Technique and diagnosis matter. Someone with weak pelvic floor muscles may benefit from strengthening. Someone with muscles that are already too tense may need a different approach. A pelvic floor physical therapist or trained healthcare professional can determine which exercises are appropriate. Now, here is another cause that often announces itself with discomfort rather than urine volume. A urinary tract infection may cause burning, pain, urgency, cloudy urine, lower abdominal discomfort, or frequent trips that produce only small amounts. Fever, pain in the side or back, vomiting, or feeling severely unwell may suggest that an infection requires prompt treatment. Blood in the urine should also be evaluated. It may have several possible causes, some minor and some more serious, but it should not simply be ignored because it happened only once. Sudden confusion in an older adult also deserves prompt medical evaluation, but confusion should not automatically be labeled a urinary infection without evidence. Medication effects, dehydration, metabolic problems, stroke, and many other conditions can produce mental changes. The correct response is evaluation, not guessing. There is also a cause many people do not expect: constipation. The bladder and rectum share a crowded neighborhood. A rectum filled with hard stool can place pressure near the bladder and may worsen urgency or interfere with normal emptying. If you focus only on urine while ignoring persistent constipation, you may miss an important part of the pattern. Now we have covered several possibilities, but you do not need to diagnose yourself. You need to collect better clues. For the next 3 days and nights, keep a simple bladder and sleep diary. This may be the most useful action you take after watching this video. Do not wait until bedtime and rely on memory. Record events as they happen using a notebook or your phone. First, write down when and approximately how much you drink. Include water, coffee, tea, soda, alcohol, soup, and other significant liquids. Second, record when you take each medication or supplement. Third, note every bathroom trip during the day and night. Write whether the amount seemed small, medium, or large. If your clinician provides a collection container and asks for exact measurements, follow those instructions. Otherwise, a simple estimate is enough to reveal patterns. Fourth, record the strength of the urge. Was it mild, moderate, or sudden and difficult to control? Note any burning, pain, leakage, difficulty starting, weak stream, or feeling that your bladder did not empty. At night, answer one crucial question. Did the urge wake you, or were you already awake? In the morning, write down how rested you feel. Include loud snoring, gasping, dry mouth, morning headache, or witnessed breathing pauses if they occur. Finally, check your ankles in the evening. Are they swollen? Do your socks leave marks? Does the swelling improve by morning? After 3 nights, compare the results. Large amounts of urine with each trip suggest a different pattern from tiny amounts accompanied by intense urgency. Frequent daytime and nighttime urination with unusual thirst creates a different picture from nighttime-only trips associated with swollen ankles. A weak stream and incomplete emptying suggest a different evaluation from loud snoring and daytime sleepiness. The diary cannot diagnose you, but it can replace the vague statement, "I go all night," with information your healthcare professional can use. Now let us turn that information into a safe plan. First, move more of your normal fluid intake toward the morning and afternoon. Avoid drinking several large glasses during the final 2 to 4 hours before bed unless your clinician has given you different instructions. Do not severely restrict your total fluid intake. Second, experiment safely with timing. Move caffeine earlier in the day or reduce it for several days. Then observe whether your diary changes. Limit alcohol near bedtime and watch what happens to both your urination and sleep quality. Third, use the bathroom shortly before bed. If you frequently feel that you have not emptied completely, ask your clinician whether double voiding is appropriate. This means urinating, waiting briefly without straining, and trying one more time. Fourth, if you have mild leg swelling that has already been evaluated, ask whether elevating your legs during the late afternoon or early evening may help. The timing matters. Waiting until you are in bed may simply move the fluid while you are trying to sleep. Fifth, break up long periods of sitting. Gentle movement during the day may help circulation and preserve strength, provided it is safe for you. Sixth, address constipation with appropriate guidance. Suitable fiber, daytime fluids, and regular activity may help many people. Severe abdominal pain, vomiting, blood in the stool, or sudden major constipation requires medical advice. Seventh, review every medication with a healthcare professional. Do not focus only on medications labeled for the bladder. Bring the complete list along with your 3-night diary. Eighth, make your path to the bathroom safer. Use a nightlight that clearly illuminates the route. Remove loose rugs, electrical cords, and clutter. Keep glasses, a cane, or a walker within reach if you use them. Wear stable footwear rather than slippery socks. If you sometimes become dizzy when standing, sit at the edge of the bed for a moment before getting up. Stand slowly and hold a stable surface. Do not race the bladder. A fall can create a much greater problem than reaching the bathroom a few seconds later. Finally, be cautious with online bladder detoxes, herbal prostate remedies, and supplements promising immediate results. Natural does not automatically mean safe. Supplements can interact with prescription medicines, affect blood pressure, or delay evaluation of the actual cause. The right treatment depends on why you are waking. A healthcare professional may ask about your urinary stream, urgency, sleep, swelling, fluid intake, health conditions, and medications. Depending on the pattern, an evaluation may include a urine test, blood tests for glucose or kidney function, a physical examination, or an ultrasound measurement to see how much urine remains after you empty your bladder. Some people may need a urology evaluation, others may benefit from a sleep study, diabetes assessment, pelvic floor evaluation, or review of heart and kidney health. There is no single pill that is right for every person because nocturia is a symptom, not one specific disease. Before we finish, remember the symptoms that should not wait. Seek prompt medical care for blood in the urine, painful urination, fever, pain in your side or back, vomiting, difficulty passing urine, or a sudden major change in urinary habits. Arrange an evaluation for excessive thirst, unexplained weight loss, persistent leg swelling, increasing daytime fatigue, a weak urinary stream, repeated leakage, or symptoms that regularly disrupt your sleep. New swelling in one leg with pain, warmth, or redness needs urgent assessment. Call 911 in the United States for chest pain, severe difficulty breathing, fainting, signs of a stroke, or another potentially life-threatening emergency. Most nighttime bathroom trips are not emergencies. These warnings are here so you can recognize when the symptom may be part of a larger problem. Tonight, do not ask only, "How many times did I go?" Ask better questions. Was the amount small or large? Did my bladder wake me, or was I already awake? Were my ankles swollen before bed? Was I unusually thirsty during the day? Did I snore, gasp, or wake with a dry mouth? Was my urinary stream weak, painful, or difficult to start? What did I drink and when did I take my medication? Your night may be revealing something that your daytime routine has been hiding. Remember the most important line from this video. The bathroom trip is the alarm. It is not always the fire. Starting tonight, complete the 3-night diary. Do not attempt to diagnose yourself. Bring the diary and your full medication list to a qualified healthcare professional. Do not stop prescribed medicines. Do not severely restrict water, and do not accept repeated exhaustion as an unavoidable price of getting older. If this video gave you a clearer way to understand your nighttime bathroom trips, subscribe for practical, evidence-based information designed for adults over 60. And share it with someone who keeps saying, "It is just my bladder," because the real clue may be somewhere they have never thought to look.